we work for federally qualified health centers. They represent underinsured and uninsured populations, and we're meeting them in their communities where they deserve and need to receive the best care, right? And so if you're able to use the data and the platform symbiotically, right, with existing social care management programs at each of the health centers, now you're able to ensure teams are focused where they need to focus, you're reaching out to the appropriate patients, and if a particular health center has an overwhelming need that they can't meet, IHP's teams can come in and shore that up. We can leverage additional data to say, hey, we realize there's a population of patients here that you're missing. They have a lot of sort of quality care gaps, or here's a population of patients we're seeing with a high utilization of ED visits, right? What can we do for them? And so we're able to tailor the program, and it's based on the data that we're seeing in Arcadia. We have an external automated supplemental data feed that goes out every month to all of our health plans, and it closes a good number of gaps, and oftentimes will push us over sort of one gatekeep or one benchmark to get us to the next level of performance. That is a huge, that's a huge activity and a huge gain that we can provide for our health centers at zero cost to them, right? We're doing it on the back end for them. We're making sure it gets done. We're reviewing it. That has been a huge sort of plus, not just from a data quality issue, but from a financial perspective as well in terms of our performance. While the front end of the platform, Arcadia's platform is really around outreach opportunities, higher level reports, there's only so much that you can do within that portal. There's only so many fields you can add, filters you can change. And so we spend a good deal of time developing custom reports for our internal executive leadership. We have a standard reporting package that leverages that data, looks slightly different, right? Because we're able to pull from fields that aren't necessarily available. We can manipulate the data in ways and provide the information that the executive leadership need. If we weren't able to access that granular data, we couldn't quickly answer questions for our customers, and we could not understand the health and quality of the data with the level of depth that we have. I cannot overstate the importance when you're in this new world, right? And at least for our system, right? Value-based care is new, and we're finding our way and understanding how we can best leverage data to inform our operations, clinicians, and executive leadership. This is the first time our health centers have been able to see the depth and the breadth of data coming from all multiple sources. And at last count, we had about 17. And so, it's one thing to look at payer reports. You can look at payer-provided reports and performance, but it's outdated, right? It's based off of claims. You have a 90-day run out, and oftentimes, if your function is really to engage a patient, if you're working off of information that is 90 days old, you're missing the mark, right? They all have EHRs within their own ecosystem, and that clinical data is much more real time, but it lacks depth if you're talking about patients who move within your network, and if you're talking about information that the payer has. And so they've been used to seeing their clinical data, right? But while it might be more real time, it lacks sort of the longitudinal capacity to look at a patient and a customer as they move through our system. So now you take that clinical data that's more real time, you flesh it out with data from sources outside of your internal systems, and then you add on the layer of the payer data, which gives you a different lens. That gives you that longitudinal record that you really need to be able to understand who are the most sort of patients that you need to engage. They haven't been engaged yet, right? And that helps their teams focus resources that are already limited, right? Who are the patients that really are high risk? We notice that they have a high level activity, they're utilizing resources. How can we implement programs to make sure they get the care that they need right on their journey within our health centers? So that level, the ability to aggregate multiple sources, and each source is important in its own way, but when you put them all together, when you're dealing with a network of people coming and going, it really allows those teams to focus where they need to focus based on their function.